Hey guys, this is Stephanie Vincent. This is my third take, so third time's going to be a charm. This is the blog for Module 3, the skills blog. So let's get started. After completing the leadership skills questionnaire, my top one was conceptual. Doing a little research on that, it's defined as the ability to think creatively about, analyze, and understand complicated and abstract ideas. I could see that being true for other jobs that I've had. Still being a fairly new nurse, I've been at it less than 2 years. I'm slowly getting around to that. I do have the want to learn more and understand more complicated ideas with nursing practice and leadership. I'm just a little slow to get there. A lot of it's just experience that I'm working on. Next was interpersonal, which I totally understand. I would think that would have been higher. I am working on conflict resolution and recognizing that and trying to nip it in the bud before it gets any worse. Not so much as a nurse, but in my previous jobs, that's what I've had to do. The floor I work on now, everyone gets along pretty good and there aren't any interpersonal conflicts. What I scored lowest on was administrative, and I totally get that. Hate paperwork. If I can avoid it, I will. It's always been the way with me. If I ever do become a nurse manager, I know I'm going to have to get over that. So the next part of this, please excuse me, I'm looking through my notes to see what is next. In terms of skills needed to secure resources, looking at staffing, I'm sure everybody's in the same boat with staffing needs. Our floor is desperately needing staff. A lot of new grads have been hired and they're training right now. Skills needed to secure those resources in a management position would be planning, trying to anticipate staffing needs. For our floor, we do hire a lot of new grads, so paying attention to when they're actually going to be graduating and applying for the jobs and trying to anticipate the needs, that would be hard for our floor because recently we had a pretty big mass exodus of some of our veteran nurses. So our management staff couldn't really anticipate so many people leaving. But with the 2 semesters previously when nursing students graduated, we didn't hire that many, so we didn't have like a pool to go to. So we were already kind of working almost at a deficit, and then when everyone started to leave, we were at a considerable deficit. Also, there would need to be communication between the staff and management about what was needed in terms of, management's going to know if the staff is lacking. They're the ones doing the scheduling, but it would help. They need the input from the floor nurses to see, is 4 patients okay? Can you handle 5? Is 6 totally unrealistic? Which, having 6 patients is unrealistic, but we're having to do it right now some. And also organizing, as in setting up schedules, interviewing, scheduling interviews, interviews with the nurse manager and assistant nurse manager, and also peer interviews. My hospital system's big on peer interviews, which is great. A lot of times, someone that's going to be working with you on the floor hand in hand has a different perspective than management when they're interviewing people. Excuse me. They could get a better idea of how they're going to work together more so than a manager, because our management excuse me, they're not on the floor 12 hours a day. They don't see what the floor nurses are actually going through, and I'm not articulating this very well. Someone that's actually on the floor could possibly get a better handle of how they would work with the person and how they would fit in with the flow of the floor. All floors work differently. We do have to work as teams to help each other, and if there's someone that you can tell right offhand is not going to work well with the team, then that might not be the best person to fill that position. That makes sense. How would you use published literature in the process? Y'all excuse me, my voice is just going. The staff would need to be kept up to date on policy changes and the evidence that's supported those changes. With my hospital system, we do have competencies that we have to complete in ACE modules, every year. It's that time of the year, and that's what I've been working on today along with all schoolwork, which is always so much fun. So that helps everyone keep up to date with policy changes. And also encouraging staff to find articles with relevant information, things that are relevant to the floor, to empower them to find where opportunities of the floor lie, and then changes that could be brought up that could possibly make things better. Our floor recently, post-surgical floor for spine and neuro patients, and we had quite a few CAUTIs. So they've changed some of the processes. Now we've cut CAUTIs down, and also central line infections. Our clinical nurse leaders have presented a lot of information. We've changed some of the ways we're doing it, and we've really prevented those too. So just giving the staff empowering the staff. If they feel like they're part of the team and part of the process, it really helps. Identify the levels and departments that you need to work with in order to be effective in your role. Again, my floor, it's a post-surgical floor. We take spine and neuro patients. So we need to work with our neuro ICU. We get all of their transfers. We need to work with our PACU for when they're sending up post-ops. We need to work with physical therapy, occupational therapy, respiratory therapy, speech therapy. We have a lot of therapies. We also need to work with our neurodoctors to make sure we're providing the care, or not providing the care, but we know them, we know the surgeries they're doing, so we know what to expect with the patients. We need to work with our case managers and our clinical nurse leaders. One opportunity that we have, since most of our patients come from the doctors of one particular practice, if we could coordinate with the nurses at the practice to help find some of the trouble spots that our patients have pre-op and post-op, it could really help with complications and questions that the patients may have. We're slowly trying to work with that. Some of our nurses, our floor nurses, have gone over there to be nurses at the practice, and they're still communicating with us some with issues that they're seeing with patients' post-op follow-ups. And we really need to do that more, because we're seeing lots of questions, the same questions that our patients are having after surgery that could have been answered before they even had surgery. Explain if you feel you would have a preference, vertical or horizontal structure. So my hospital system, it's a large hospital system in Charlotte, and it is definitely vertical. We have our CEO, and then under the CEO, there's a ridiculous amount of vice presidents, senior vice presidents, regional vice presidents. It's really, really weird. So there are a ton of vice presidents. And then there's, house manager, division manager, floor managers. So that would be our nurse managers. And then even on the floor, we have assistant nurse managers, and then almost like assistant nurse managers, and then all the floor nurses. So it's very, very vertical. But what's cool about that is you have a hierarchical, you know what I mean. You know where to go if you have issues. If you have issues with up here, you can go to the next level, to the next level, to the next level. And for healthcare, I think it works really well. My husband works for a horizontal company. So it's the owner, the manager, and then everybody else. And it's getting to the point where it's just not working for them. I do think a matrix approach would work really well, where everybody's working in teams and groups that share a common goal. With our patients, that would really provide a great continuity of care if everybody is working toward the common goal of providing the patient with the best care and also giving them the best quality of life. If our therapy departments, clinical nurse managers, nurse leaders, case managers, and the floor nurses, and also the nurses with the practice, if they're all working together for the common goal, it's going to provide the patient the best care possible. So this blog got way too long, so that's